Would you like me to share my screen and bring up the agenda?
That would, I think we'll just, no, everybody should have it and we'll just run through it. I'll just run through it now. Okay, thank you everybody for your patience with this issue with the Zoom meeting. Apparently it's a government account issue. So we'll make sure that doesn't happen again, hopefully. And let's start with the approval of the February meeting minutes. Were there any edits to that? No. Can we have, is there a motion to accept the minutes?
Motion to accept.
Thank you, Libby. Is there a second? I second. Could you please enter your vote in the chat, whether you say you approve the minutes, and you say nay for not approving, and abstaining if you weren't at the meeting. Okay, me Chase. All right. I think minutes are approved. Liz, Gabby, can you send Barbie Law? Can you forward that? Just send her. Never mind. I'll get it. It's okay. Sorry for a minute. I have to take care of one issue. She can't hear anything. Can you see the chat? Barbie can't hear anything, but the meeting isn't open. I'm not sure how she's getting onto the chat. Do you?
I can email her our current Zoom link.
That would be great. Thank you. Okay, minutes approved. On to the next issue. We have a request for a nomination to the HIV Health Services Planning Council. And we do this, they report to us and we have to approve their nominations. This person looks very well qualified. You would have seen Jose Vega, the request for his nomination approval. And is there a motion to approve?
I had a question. Is there a written request for approval that went out?
Yes, it went out with the agenda and the two letters that we're considering. So the email to you.
Interesting. I don't recall seeing them. All right. Thank you.
I'm sorry about that. Would you like me to send it now?
You know, the more problematic it's going to be the two letters. If I'm the only one who didn't get it, don't worry about it. I'll just abstain. Thank you.
Oh, okay. Oh, let me try and get that to you. Or better, yeah, Gabby, can you forward to Steve Heath the email with the letters and the agenda?
Yes.
That would be great. Thank you. Steve has 2 emails, but I presume either will work. All right, so we'll take a vote on approval of HIV nomination. Is there actually, yeah, I think we don't need to do a motion on this. It's just an approval, aye or nay, for his appointment. I think that's, do we have everybody's vote in? I'm not sure we have. Okay, 1, 2.
Okay, Steve, I sent that over to you.
Okay. All right. Nomination is approved. Thank you, everyone. All right, we'll move on to next agenda item. We're running a little late and hopefully we'll catch up. Dr. Kassirier, would you give us an update from Public Health, please?
Yeah, I'll keep it very brief.
Thank
We
you.
have changed our cadence for updating our dashboard. So many of you may have been checking it to see updated numbers. We have gone to updating just once a week. So today it should be updated with the numbers. I haven't had a chance to check it yet, but we know that the numbers continue to trend downwards. At the state level, a couple of things. One is that the state this week updated the masking mandate, and now it's just highly recommended for everybody, regardless of vaccination status, except for high risk settings such as healthcare, the public transportation, jails, and shelters. And for schools, the update will occur on March 11th, and it will become a strong recommendation in schools at that point. I think those are the major updates. Oh, the other is that the state also released what they call a smarter plan, basically kind of like a white paper as to what we're going to be doing moving forward as we get off of the surge with Omicron, and hopefully no other variant rears its ugly head. So how do we remain vigilant, but at the same time also be able to allow the communities to move into more of what might be our new normal, but also being able to maintain focus on vulnerable populations that still are lagging behind in vaccinations, but at the same time also have a disproportionate burden of COVID hospitalizations and deaths. So those are the high points.
Thank you. Good news.
For once.
Exactly. So I just want to put in a request for some updated, some funding features. As PHAB has been interested in letting the Board of Supervisors know about our recommendations for increased funding for public health, as since the funding cuts from the last few decades have been quite devastating. I was wondering if we could get some of those funding numbers from public health for the last couple of decades. Is that a big ask?
I think so, because I would have to ask our fiscal folks to get those numbers together. So I don't know how long it will take. So how many years do you want to go back?
Well, the trend over time, kind of, but maybe we can talk about the specifics at another time. But
Sure.
I just wanted it on record that we'll be looking into this, and some of the funding numbers will help. So I will talk with you a little bit about that after, and maybe next meeting PHAB can talk about actually can look at some of the features. But thank you.
Okay.
I think Sandy was having trouble getting on. Gabby, can you just make sure that she got that email, the last email that she was on, the new, containing the new invite?
Yes, I'll go ahead and send it to her one more time.
Thank you very much. Okay, so next item, we'll skip Sandy's update until she joins. And I'm going to switch. Okay. All right, so Michelle is joining us today, representing Substance Use and Prevention and Treatment Department, and she will be giving a brief update. Andrew Mendoza will be doing this pretty regularly, but welcome today, Michelle.
Thank you, Farla. So I'll try and keep my update pretty brief because I know we're running a little behind. So our department is currently working closely with public health and the DA's department to get in front of the fentanyl epidemic that we are currently seeing in Sacramento. We have a number of middle school children falling prey to fentanyl overdoses. So that's definitely on the forefront. In addition, we have a prenatal substance exposure training series coming by Dr. Ira Chasnoff, a national leading expert in the area. He will be providing training to our SEPT providers, as well as CPS, health department nurses, and any community providers interested in participating in the series. If you have staff who are interested in participating, please reach out to me directly and we can get that scheduled. In addition, we have a MAT training partnering with Sierra Sacramento Valley Medical Society to get a number of medical providers in the community who are comfortable prescribing MAT and detox medications to clients in our community. We are also working to get information out regarding meth, which is still the most used substance here in Sacramento. We have some new PSAs and media materials rolling out over the next several months. We are continuing to get out in the community and get out Narcan. So if you're interested in getting Narcan or training on Narcan, please let me know. I can also put my email in the chat for that. We are also very excited to be on the forefront of innovation with the current contingency management state pilot program. Our department was recently accepted to that, so that will be starting July 1st of this year. We're working with WellSpace, moving forward with a meth-specific residential, so that is also coming up. We're excited to be contracting with Stanford and UC Davis in our ED Bridge program, and we're continuing to identify residential providers and expand our continuum of services. And that's it for our department. Any questions?
Oh, that sounds great.
Thank you.
Can I ask a quick
yes,
question?
please.
Of course.
Sorry, I don't want to take too much time, but just in regards to residential bed capacity, do we have any updates kind of on what the average wait times and stuff are, or any plans to kind of increase our bed capacity in the county? I know that's an ongoing project.
Yes, it is an ongoing project. We are currently working with WellSpace on the meth residential. So that will increase our bed capacity. And we're continuing to work to identify additional providers who are interested in residential services. But it has been a struggle, even with COVID. When our facilities have COVID outbreaks, it causes us to have to pause intakes due to the COVID outbreak, and causes more of a backlog for clients trying to get into residential treatment. So it has been a struggle.
Along those lines, just a comment and maybe a question. The 24-hour detox facility that I think is available through WellSpace has been, I know it's limited capacity, but it has been really incredible for people. I'm a emergency doctor, and so I've sent a handful of people to the 24-hour detox, and I think that is an incredible resource that I hope we can kind of continue to expand access to.
Yes, you're referring to the SURE program. It's a wonderful
Exactly.
resource, and we were able to get funding to continue to fund it for the next year.
Fantastic. I'm very happy to hear that. Thank you for all your work.
Thank you.
There's also a question in the chat. Do we know how many beds are currently available in the county in total?
I do not have a current number on bed capacity. So, but I know all the beds that are at our contracted facilities are currently full.
Okay.
Could we possibly get some follow-up information with bed capacity and current wait times? I think I'd appreciate that, and I assume others would as well.
Yes.
Thank you so much.
No problem.
Thank you. And please do enter that Narcan information in the chat. That would be great, Michelle.
Okay, great.
Thank you so much. Okay, we're going to have a brief update from Sandy, who's been able to join us. So sorry for all the technical issues and the confusion with this. Gabby, could you bring up Sandy's update and share it on the screen? That do while she goes through it.
Okay.
Yes.
Good afternoon, everyone. I'm Sandy Damiano, and sorry I didn't get the link, so I wasn't here on time. I have a number of items that I think you'll get in the minutes, but I just wanted to hit some high points if possible, and hopefully she's bringing up the document right now. For juvenile correctional health, for COVID, they've had 104 cases throughout the pandemic. They only have one new case in this particular reporting period. They have vaccinated 118 youth, but for a point in time, as of February 22nd, the youth, there were 34% of the population was vaccinated for that point in time, and 7% had boosters. For adult correctional health, hopefully you'll be able to see it pretty soon, but I had posted our last dashboard. If you could scroll down a little bit to the adult, just a little bit, scrolling right there. Oh, oops. Right where that table is, a little bit there, right there. Thank you. So the dashboard's on there for last Wednesday, which was February 23rd. As you can see, on that particular day, we had 42 cases in custody that were confirmed COVID at the main jail, 10 at the branch jail. I'm very happy to report today we have 5 at the main jail and 12 at the branch jail for a total of 17 cases. So we have been coming down from the outbreak, the Omicron outbreak, which has been really, really tough on us. As of Monday, we were at an average daily population of over 3,400. So we've been running extremely high census. Today, we're at 3,100. So I'm hoping that continues because that also has been really rough on us. If you keep scrolling to the next table of data on the next page, there we go. For the vaccination data, can you scroll just a little bit? We're missing a couple of numbers. Okay, that's a little bit higher, I'm sorry. On February 23rd, we had 2,796 inmates overall have gotten vaccination doses. I was asked to do a point in time count, which we particularly do every so often. This is a point in time count for February 23rd. At that day, we had over 3,300 cases in custody. 27% of the census had completed one dose and 25% were fully vaccinated. That's slightly down from our last point in time count, which was a few months ago. However, if you look at the point in time count by length of stay, if you could scroll just a teeny bit, what you'll notice is that 89% of those who have been in custody for more than 60 days have had at least one vaccination dose. So for those with longer lengths of stay, they do tend to get vaccinated. If you keep scrolling for the staff vaccinations, I can't remember if anyone asked me about that, but we did a point in time count on February 10th. You can see for the medical and administrative staff that's out in the jails, they're 93% vaccinated. You keep scrolling, you'll see that we're starting to check on boosters and they're 45% vaccinated for the booster shot. So up to date on those. I did not have a point in time count for the mental health staff in terms of their booster doses, but I did know that they're 95% vaccinated and we'll get the booster dose information hopefully later. Everyone is still working on compliance with the state public health order for correctional facilities in which staff must get boosters or they're exempted and test weekly. We did have a little bit of ability to defer some of the boosters in case people had COVID infections. That's one way it could get deferred. Okay, I added some other things that are non-COVID related in the report. If you can scroll down to those next tables. For our vacancy reports, they're still high. We have 27 vacancies for the medicals team, 7 vacancies for the admin. And you can scroll to the next table. We have 14 vacancies for mental health. What I am happy to report today is that for both the medical and mental health teams, they're noticing since the Omicron is getting more in control in the community, they've started having more applications, people seeking out employment, and hopefully those will go well. When the COVID was at its peak, doesn't go so well. Okay, next table, other kind of data that I know that you're interested in. This is the average daily population totals by month, and you can see I did 3 fiscal years. This was as of December. Like December was 3,255. We've been running over 3,400 recently for the past month, so we will be keeping to add on. So you can see we're getting to our pre-pandemic levels, although this is starting year 3 of the pandemic for us. Okay, if you scroll to the next table, and I apologize, I'm going so fast, but I know that you're probably behind on your schedule. For the jail releases, this is always confusing to people. So just wanted to point out that 28% of the population is gone. They never get booked into housing. So that's quite a lot. And that 56 are released within 3 days. So we have an extremely high churn rate on the upper tiers of length of stay. And then we also have a very long length of stay population. So very hard to plan for those 2 very distinct populations. And this also makes it harder in terms of COVID management when you have so much churn going in and out of the facility in terms of trying to maintain control. If you scroll just a little bit, last time I gave you some information on the seriously mentally ill and showed you our quarterly report. This is just a snapshot of chronic conditions. We did a snapshot December 29th. We had an ADP over 3,300 inmates. 71% of the incarcerated population had 1 chronic health condition and 63% had 2 or more chronic conditions. Okay, and I think at least 60% were on medication. I didn't put that data in there. So I went through that quickly, and then I'm sure Gabrielle will put that in the notes so that you can look at it a little bit longer instead of going over it so quickly. But I wanted to see if anyone had any questions.
We have time for a very short question, if there is one. And thank you, Sandy, for providing that and for being responsive to requests for certain numbers. Thank you. We appreciate it.
Oh, you're welcome.
And I think is there a question?
Let's see.
Okay. So we're going to go now and just switch the schedule a little bit. We have the 2 draft letters to the Board of Supervisors, one concerning correctional health, which will come after the youth behavioral health letter that we'll take up at the moment. So Gabby, if you could bring up the youth behavioral health letter and share on the screen, and Sonal will give you an overview of the letter, and the discussion will follow briefly so we can get to the other letter. So Sonal.
Yeah, hi everybody. So, I think as a little bit of context, COVID has had a significant impact upon mental health for all people. And there's been a lot of interest and concern among stakeholders locally and nationally regarding the impact upon youth mental health. In particular, I think a couple of things I've heard recently is, as COVID is the storm, but mental health is sort of the tsunami that's following. If you're tracking sort of what's happening nationally, the United States Surgeon General also issued a warning as well as a call to action to address the emerging youth mental health issues that have only been exacerbated by pandemic. More recently, we heard from the the Ad Hoc Mental Health Collaborative, and this was back in August, where a collection of some school board members, the Sac County Board of Education, and in particular advocates and youth came in and sort of shared their experiences navigating the youth mental health system in the school settings, initiatives that have been implemented on school campuses, and sort of what they think needs to be done next, in the near future, as well as sort of the long term. So some of our conversations sort of after this, we're really thinking about what are some ways that Sacramento County can really support its youth in the very near term. And with the help of the information shared by the collaborative and then some ongoing conversations we had with Bina from the Sac County Board of Education, as well as Dr. Quist from the County Mental Health Department, we developed 4 recommendations that we would like to take to the Board of Supervisors to request or to basically give our support for. And we consider these to be really what we're calling kind of low hanging, not too hard to implement, but really in alignment with some of the needs of the youth, with really the longer term goal of developing a more comprehensive strategy in collaboration with all the pertinent partners. So I think the thing I would want to clarify is this is obviously not a strategy or, a comprehensive solution. It's really just identifying a couple of things that we can implement quickly and efficiently that have shown to be impactful. And these recommendations are largely in line with what the collaborative also wanted to see. So, I think what I would just mention is the first page kind of provides like a background on the issue, some particular startling facts or data points, which I, personally was quite surprised at. And then the second page really talks to our recommendations. And the 4 recommendations that we're putting forward, that we would like to put forward with PHAB support are: 1, increasing youth and parent-friendly mental health literacy. 2nd, additional training for teachers and staff, particularly on mental health screening and early intervention. So really the focus on prevention. The 3rd, increasing access or providing access to telehealth through mental health services through telehealth, whether that be an app, whether that be, some other system. There's a lot of systems that currently exist. We identified one system through Kaiser that's called Calm and My Strength, and these were made available to all Kaiser members, and they've been shown to have very positive outcomes. And then the fourth one is peer-to-peer and near-peer mentoring programs in schools. And I think, the only other thing we'd like to mention, and happy to kind of just continue conversations on these four, are, again, just want to reiterate that these are just sort of short-term initiatives that can be made to really help Sac County youth in schools. And there are other challenges as well as goals that we'd like to see in the longer term, but we think this is just a really good start and things that the Board of Supervisors in Sac County can sort of take on more immediately. And Farla, I don't know if you have anything to add on that, but I think I'd like to just sort of take some feedback or have any additional, if people have questions, respond to those.
No, I think you did an excellent job of covering it, but we will open it up to questions and comments now. No comments, no questions. It's so clear. It was laid out so well. Okay, are people ready to vote on this? And what we're voting on is sending this letter to the Board of Supervisors with PHAB's recommendations. So do I hear motion? So the motion is for voting on this letter to the Board of Supervisors. So
Can I motion, Farla?
yeah, I think
Okay,
so.
I'll put
So
forward a
now
motion to that.
Is there a second? Are there any questions about this? No questions.
I'm happy to second.
I guess I will second. Ah, okay. So could you enter into the chat the vote on the youth mental health or behavioral health letter? I will put an I in, and Barbie says she has to abstain because she can't hear anything still. Gabby, could you see if you can work with her?
Yes.
Thank you. All right, so now just have to make, we have Libby. All right. I'm not sure I have everybody's vote. Larissa, you still are able to vote, and Steve, not sure. Did we lose you, Steve? No, oh, there we go. 1, 2, 3, 6. Wonderful. Thank you, everybody. Motion is approved. We'll be sending this to the board shortly. Thank you. Thank you very much, Sonal, for doing that. Really very much appreciated. So much work went into that. Congratulations, Bina. I think you get a recommendation to the board. Bina's with us today. This is quite something. These youth absolutely need this help, and hopefully, I'm always told that our letters are viewed very favorably. The board really values our input and our recommendations. So we will proceed to the next item, which is another letter to the Board of Supervisors, and I will let Libby present that to you. So,
Great.
Gabby, can you bring up that letter?
All right. I think while we're pulling it up, I was thinking just for a walkthrough, I'd kind of do a little bit of what Sonal did, just give kind of the background on how we got to where we are. sort of some of the justification for the general thrust of our recommendations, and then hopefully folks have had a chance to read through the letter, so won't do kind of the detailed walkthrough, but we do have quite a number of folks from the working committee here on the call.
Thank you. Apologies to everybody for that snafu, another one, but we've reconvened, and Gabby will bring up the letter again. Thank you. And Libby, you can start over or where you left off.
Okay, great. Excellent. So I think what I'm just going to do, like I said, is walk people through how we got here, what the general thrust of the letter is, and what our overall goals are, and then pause and just let people come in with questions if there are any on the specifics of the recommendations. So for context, we've been, as PHAB, have been looking at issues related to correctional health for a little over a year now. We started at the beginning looking in specifically to the Mays consent decree and kind of understanding the findings from Mays, as well as the remedial plan and sort of, what the recommendations are there to address some of the issues that have been identified in the jails. And the issues are really complex, but one of the things that has kept coming up, both in kind of the expert monitoring reports from Mays and our stakeholder interviews, is the conclusion that there are too many people in the jails, and that's sort of the root cause of the issues. And specifically, there are too many people in the jail. I think can everybody just go ahead and mute? There's some background noise here. Too many people in the jails who have a mental health need. So we have 82% at the last sort of stock take, 82% of the jail not convicted, 66% of those people who were pretrial, i.e. did not have a conviction, had a mental health need. So that means at least half of the jail population in that moment has a mental health need at the latest count. From a public health perspective, we've taken the stance that a jail is not a therapeutic setting, that as public health practitioners, we're thinking about preventing the root causes. And we want to think about how to better meet the health needs of those populations, including that sort of disproportionate share that has a mental health need, by connecting them to services and not necessarily putting them in a non-therapeutic setting like a jail. So this is sort of generally true in principles. The principle that we've taken, it aligns with the recommendations of the American Public Health Association, which encourages sort of jail population reduction and specifically connection to services. It's also acutely true in Sacramento, where we know from the Mays monitoring reports that healthcare and mental health care for folks inside the jail is not just inadequate, but inadequate to the point of doing harm and accelerating, in some cases, decompensation of individuals as the nature of the conditions in which care is provided or not provided due to the structural constraints. The county, the final sort of key point here is that the county is already compelled to reduce the jail population through the Mays consent decree, and there was a recent US Supreme Court case that further indicated that folks who are pretrial in particular should not be defaulted to jail, but they should be given the option to be connected to services as needed. So all of this, I think, rolls into a really clear justification for making recommendations around diverting folks from the jail pipeline and making sure that we're investing in the infrastructure that will allow those individuals to access the services they need and sort of exit the cycle of incarceration and recidivism. So our goals in this letter were to sort of answer a couple of questions. One, what can be done to divert people from the jail pipeline? And two, what kinds of services can be strengthened or expanded so that people who need mental health care and other wraparound services, such as housing, get what they need and sort of get out of that cycle. And specifically, our aim was to make recommendations to the Board of Supervisors along these lines, but to do so ahead of the budget cycle. So with the budget cycle in mind, we really wanted to make sure that the supervisors can make decisions that allocate resources to the programs that we know work and the services that we know are needed. The final point, I think, is that we wanted to recommend not just utilizing the general fund, but also encouraging the Board of Supervisors to use the American Recovery Plan, ARPA funding, as well as AB 109 funding, which relates to county capacity to handle incarcerated individuals. So that's where I'd like to pause, because I think that in the 6-page letter, we pretty thoroughly go into the recommendations and the justifications and specifics of each. and happy to take questions. Maybe before questions, I'll just ask if anybody else from the working committee would like to add anything. Okay. Great. I mean, feel free to unmute folks on the working committee if there's anything that comes to mind that you think we should articulate in terms of the thrust behind the letter. Otherwise, I think we can open it up for questions and reactions.
No comments, no public comments. We can open that up too.
Hey there, this is Chase. I have one quick question. First of all, Libby, thank you and the committees for all of this awesome work. I think the letter is so easy to read and it's very clear how you formatted it, which is great. I'm looking at the letter and I can't quite find the exact sentence that I am remembering, but it was something about increasing the county's reimbursement for mental health services or something along the lines of that. Do you know where we stand in relation to other counties for our reimbursement?
So that's a great question. And just so everybody knows, we're referring to 2C, which is on page 5. So I don't think we have those specific data. It'd be great if we did. I also think that this is something that has come up consistently in our stakeholder conversations, but we haven't really gotten to the root of sort of like what it would take to change that or whether that's in the realm of possibility. Our aim with this specific recommendation is to stimulate a conversation on it. So to get the Board of Supervisors to react. I actually meant to say in the kind of preamble, the overview of the letter, that our goal here is not just to issue the letter, but Farla is getting us on the agenda for a Board of Supervisors meeting in April. So we want to make sure that this one, and I think Schmick, which is 2A, those are two pieces we kind of want to get reactions from the board on to understand why haven't we addressed this already? What are the barriers to resolving these two sort of seemingly obvious issues? So there might be more nuance to it than we understand. Anybody from the working committee have more they want to add in terms of what we know or don't know about payment rates vis-a-vis other counties?
Yeah, I don't know the exact, I know it varies county by county. I'm not sure the exact number other counties pay. I just know it's more than, they pay more per bed, psychiatric bed than we do, even after, and I think Sacramento County increased ours slightly in the last few years, but yeah, I'm sorry, I don't have those exact numbers right now.
Yeah, just to speak a little bit to this, there's multiple layers of complexity here where many of the health systems will occupy certain numbers of beds so they can decongest their emergency rooms. This is something we've kind of dove into a little bit, but there's kind of multiple layers of kind of limiting the access of these inpatient beds. And I think our county behavioral health team and stuff has really tried to invest more kind of in the outpatient side and has focused less on kind of expanding these inpatient beds. And so it's kind of an ongoing conversation on that front. But between the combination of other counties occupying inpatient beds and the health systems occupying inpatient beds, there's really kind of limited access for Sacramento County itself to occupy all of the inpatient bed capacity that we have.
Okay, there is a question in the chat. Who were the stakeholders with whom you consulted?
Yeah, happy to answer that. We have had a good long list over the year. It's been a good learning process. So we most recently had a conversation with the sheriff's office, including the 2 compliance officers, thanks to Dr. Damiano for providing that connection. We've met with the behavioral health division, including Dr. Quist, as well as Jeff Twitchell, who's the head of the new forensic behavioral health division. We've spoken with, from the beginning, Dr. Damiano, County Council, Dr. Katari, Supervisors Cerna, Kennedy, Natoli, and Desmond. The Prison Law Office, which was one of the plaintiffs' counsel in the Mays agreement. The former Inspector General Mark Evans, who I believe has stepped down, or at least has announced he will be stepping down, and then Tiffany Stinnott from the Public Defender's Office, as well as the Mental Health Board, which is also considering this issue and plans to generate their own letter of recommendation to the Board of Supervisors with actually very similar recommendations. They're still kind of coming to conclusions around what they want to recommend, but tend to be heading in the same direction.
Okay, any other questions or
Oh, and we
comments?
spoke with the collaborative courts as well. Sorry, that list might be incomplete. If I missed anyone, feel free to come.
Okay, well, if I hear no other questions or comments, we can ask for a movement to accept, well, to approve this letter to be sent to the Board of Supervisors.
Movement
Is
to
there-
approve.
Great. Is there a second?
A second.
Thank you. Okay, could you let me just put this in. Vote to approve. Okay, could you enter your vote into the chat, please? And I'll try and keep track of that. Oh, there we go. That's better. Okay, Phil. 1, 2, 3, 4, 5, 6. What do we have here?
Oh, I probably need to write mine in, sorry.
Okay. Great. All right. We have approval of the letter. Thank you so much. And as Libby mentioned, PHAB will be presenting to the Board of Supervisors. Well, it's referred to as having an item on the agenda, which we haven't done in my recollection of being on the board. So it's exciting. We will present them with these two letters, and that might become a more regular occurrence as we write letters. And it's an opportunity for us to present this to them in a possibly a little bit more expanded format, as well as to engage in a conversation. The Board of Supervisors is also under the Brown Act and cannot discuss these issues except in board meetings, because they also can't have private meetings. So if more than two of them meet at a time, it's considered in violation. So this will be very good, I think, a very good opportunity to engage with them. Wonderful. I think I think we've about covered everything that we had on the agenda for today, which is amazing considering our technical issues. Are there any other public comments or anything anyone would like to add to this at this time?
I just really quickly wanted to acknowledge all the work that went in from our kind of community members that have been helping with our jail health efforts, Liz and Lynn and JL and Steve and others. So thank you everybody for all this effort.
And PHAB absolutely thanks the committee for all of its work. As you heard from the long list that Libby presented about who the committee has spoken with and has met with on these various issues concerning correctional health. It is extensive. The whole issue is very, very complex, and they have done an amazing job of trying to wrap their heads around it and understand it enough to know who to speak with, who to engage with. And I think it's been an amazing effort also, and a successful one in including public community members in our investigation of this issue. We haven't done that. Again, maybe before my tenure, but I haven't seen that done. And I'm very pleased that it worked out so well, and we'll continue to take advantage of that aspect of our bylaws that allow for this. So, and the committee is not finished yet. So it's been very successful, and we look forward to much more success. So thank you so much for your dedication, and everybody who's been involved in it. All right, if there are no other public comments, I'm going to adjourn the meeting. Or that includes PHAB comments. No? Okay, thank you so much for your stick with it with these links and the Zoom things. And thank you, Gabby, for working all of this out, and Liz, who's on vacation, but in communication, trying to clear this up and make it work, and you made it work, and we so appreciate it. Thank you, and we will meet again in April.
Thanks, everyone.
Congratulations.